All parents have been involved. We have an income generating unit where we make our own uniform, aprons. So we have different parents who are involved with different activities.
Kwa majina naitwa Yukabet Nyaboke, ni mzazi mwenye ako na mtoto mlemavu, ako na cerebral palsy. Melody wakati nilimleta Little Rock, alikuwa na miaka 5. Alikuwa anajificha kwa nyumba. Mzazi mwingine akaniona siku moja na mtoto, akaniambia iko shule nyingine iko huko juu, jaribu uone kama watachukua mtoto. Achapakua watoto. Aseme huyu ni mlemavu kana huko. Au huyu ni mzuri kana huko. Yeye ana hiyo nini? Watoto wote anaona wako level moja. Melody yako TTI anasomea ECD. Anaenda kumaliza hii mwezi wa 11 anaenda kufanya.
Rock is a good school. When I search for schools, I got this school, and then I love it, and I registered my son. And then they call me after some times. They evaluate my son's condition. And they told me to go to the hospital and study a doctor. So when I see the doctor, they told us he's mild autistic. So with the help of the school, now he's progressing and at home, and then we assist him by any means. So now he can't stand. He's like 3, and next 21 is 7 months. So he's okay now. He can use toilet by himself, especially urine. Focus. We are focusing on the urine. So he's doing that, and then he can wash his hand, and he tries to speak now a little, and he repeating words like this. And then sometimes he can sing also, but he's very happy kid. He's playing, he's friendly.
For us who have been in the space for a longer time, we are excited because now people are recognizing that foundational stage is very, very important. So it is positive to the learners, particularly those ones who are in the bracket of 3 to 5 years. Once we get it right there, then the child is able to thrive.
Children who are cared well, we will be having a great nation because we have provided the proper care of our children.
The Ministry of Education, for the first time, by the way, came up with a policy on pre-primary education. That is the National Pre-Primary Education of 2017 and the Standard Guidelines on 2018, which provides guidelines on how caregiving should happen for children aged 4 to 5 who are in school. For that one, we have no problem. But this other function of child care facilities, which was devolved to the counties, we did not have a national policy on child care that was developed then. But our counties were very creative. They came up with Child Care Facilities Act that provides guidelines on how should be happening. While counties have Child Care Facilities Acts, implementation might be a gap because, and that's where I call for non-state actors who are working on the child care sectors and who are implementing even other programs to ensure that implementation of these standards and the guidelines that have been developed by various counties are implemented.
development. We promote, support, and sustain a nurturing environment. Commitment and inclusiveness, mutual trust, respect, and integrity, partnership and collaboration, promoting ECD environment, a society where all children realize holistic development. We promote, support, and sustain a nurturing environment, a society where all children realize holistic development. We promote, support, and sustain a nurturing environment.
Good afternoon. We are here this afternoon, the first webinar for 2025. We are glad to see you. It's the first time we're meeting in a webinar, so Happy New Year, although it's a bit late. We have got a series of webinars this year, and we are starting off with our webinar this afternoon on strengthening early childhood development in Kenya, and it will handle financing, policy integration, and multi-sectoral coordination. This is our second year for us arranging this sort series of webinars. We are excited that you're part of that, and we look forward to an exciting year. And I need to tell you that this year is not just about the webinars. We also have a conference. We usually have ECD conferences happening every 2 years. This year we have one happening in Garissa. It's happening in July. And we are looking forward to you joining us in July in Garissa for that conference. That conference brings together, we expect it to bring together about 1,000 people. And we invite you to be there too with us. It will bring together policymakers, government officers, leaders from national county government, civil society organizations, research institutions, private sector, donors, media, researchers, ECD practitioners, and of course yourself. So we encourage you to register for that conference. And also if papers, we are looking for papers, there's a call out for papers, look out for them, and also register to and sign in and hand in your paper so that we can benefit from your participation in the course of that conference. The conference, the session today will bring together 4 experts, Professor Teresa Moma, Dr. Moses Oyagi, Dr. Caroline Mwangi, and Mr. Eric Waga. They will take us through their presentation. They have done a research. They want to share with us what they have found out in the field. And we will be able, once as we listen through, to interact with them in question and answers. So we encourage you to write your questions as you go along. We have a chat where you can register, you can write your questions as we go through the presentation. We will have time at the end where you can, those answers can be made. You can get answers to your questions. And if there are further questions that you've got, we will then be able to engage with them as we proceed. So we encourage you as you register, please on the chat, write your name, write your organization, where you're joining from. And as I have said during the webinar, there will be a question and answer. So please write your questions and we will be able to respond to them before the end of the webinar. We expect to be here for the next 1.5 hours, and it's going to be an exciting time. We will start off with Professor Moma. Professor Moma is well known to us. She is a founder of this network, the ECD Network for Kenya, and which is hosted at the University of Kenyatta University. She has been in the ECD field for a long time, since 2015. And she is involved in a number of initiatives. She's a lecturer too at the university and has taught many of those who are working in the sector. She has conducted over 20 studies, 20 years of experience in this field, and is currently engaged in working with the Tharaka Nithi County to investigate around a program on childcare together with the Gates Foundation, which working together with Kenyatta University and Yale University to do an RCT study. And she's a co-PI on curriculum intervention.
Okay.
So I would like to invite, as we go through this presentation, I would like to invite you once again to this webinar. Write your questions as we go along. If you've just come in, please register, write your name, your organization, and where you are from. And as we go through the webinar, please make sure that you register, you write your questions. I'll be moderating this together with Sally Mora, who's a co-moderator with me. She will also participate as we proceed. Right now, I want to welcome Professor to take us through the findings.
Okay, thank you so much, moderator, and thank you, colleagues, for creating time to join this webinar. And the webinar is giving us an opportunity to share research findings from the study that we have been conducted. And we are now today focusing on strengthening early childhood development in Kenya. And our focus will be on financing, policy, and multi-sectoral coordination or governance. The research team, as the moderator has indicated, include myself, Dr. Caroline Mwangi, Dr. Moses Oyagi, Eric Obina, and many more who are giving a hand to ensure that the study is a success. Next. This afternoon, I want to take you through an introduction and methodology of how we conducted this study before we start disseminating the findings that we found. This project is happening in 3 countries, that is Kenya, Tanzania, and Mozambique. It is funded by Conrad Hilton Foundation. And for the project to be coordinated in the 3 countries, Hilton Foundation contracted Mathematica. And in Kenya, Mathematica is partnering with the ECD Network for Kenya. The project had 2 phases. Phase 1, which happened between 2022 to 2023, it involved the research team to develop a measurement framework. We piloted that framework in 4 counties. Using findings from the pilot, we were able to revise the measurement framework, and we used it to collect data in 2024, which we are now sharing. As part of the framework, we came up with indicators that are used to measure policy, governance, and financing in early childhood in Kenya. Under policy, we had 2 indicators. And one thing you are going to realize, every indicator, we were looking at how it applies at the national level and also at the county level. So for policy, we had 2 indicators. The first one, which was measuring the degree to which existing national level sectoral policies cover the components of nurturing care. And the second was focusing on how it covers the components of nurturing care at the county level. And out of the nurturing care components, you will realize that we were using the subcomponents for each component, which will be presented later. Under governance, we had 5 indicators. The first one was measuring the level of functioning national government-led multi-sectoral coordination. The second was focusing on the same, but at the county level. The third was focusing on involvement of the CSOs, the private sector in the coordination mechanisms at the national level. And the fourth was focusing on the same, but at the county level. Number 5 was focusing on the extent to which the national and the county levels information systems provide data to inform policy and decision-making on nurturing care components. On financing, we had 3 thematic areas where we were focusing our indicators. That is early childhood education, financing on primary health care, and social welfare financing. And each of those had 2 indicators, one focusing on budget allocation, the other focusing on expenditure. So under early childhood education, we were looking at budget allocation to early childhood education as a percentage of total Ministry of Education, or at the county level, the County Department of Education. In terms of expenditure, we were looking at the expenditure on early childhood education as a percentage of the total budget that was allocated for early childhood, either at the Ministry of Education or at the County Department of Education. For primary health care, because primary health care is wide, so we had to look for a proxy that we can use and that we think programs funded through that benefit children 0 to 5 years. And the proxy we arrived at is to focus on promotive and preventive. So when I'm talking about allocation or expenditure on primary health care, it is important for you to note that we are focusing on that proxy of promotive and preventive. So the first indicator on that was budget allocation to primary health care as a percentage of the Ministry of Health, that is at the national level, or County Department of Health at the county level. In terms of expenditure, we were also looking at the expenditure on primary health care as a percentage of the total budget that was allocated for primary health care. Social welfare financing, we had 2 indicators, budget allocation to social welfare programs, targeting children 0 to 5 years or their families at the National Department of Children's Services or at the County Department of Children's Services. Expenditure also was on the same, focusing on expenditure on social welfare programs compared to the total budget that was allocated for the social welfare programs. So those are the indicators that we were using in measuring those various thematic areas, that is policy, finance, and governance. In terms of methodology, we used the mixed methods approach, where for quantitative and qualitative, where we utilized, for quantitative, we utilized desk review. We reviewed documents for all the 47 counties. And as we were screening, we noted that those that could inform us were the county integrated development plans and the county or national budget implementation review report. For qualitative data, we utilized focus group discussions with community health workers and key informant interviews for government officers, both at the national and the county level, but also civil society organizations at the county and the national levels. We conducted this study in 7 counties to collect qualitative data. In terms of desk review, we followed 3 steps. Next, please. We followed 3 steps. The first step, we engaged research assistants who helped us to do a primary search and download finance and policy documents that could be used to inform our study. And we downloaded 731 finance documents, 117 policy documents. Step 2 involved us screening to establish which documents speaks to what we were looking for. And our focus was on finance and policy documents which were either developed in between 2020 and 2024. Then out of our screening, we realized that 723 documents, finance documents, did not meet our eligibility criteria because we were keen to get documents that can help us consistently compare all the 47 counties. And then for policy, also we noted that 49 documents did not meet the eligibility criteria. That took us to the last step, whereby we were now able to review policy documents, 56 policy documents, comprising of 47 county integrated development plans, 2023-2027, and 9 national policies related to health, education, and social welfare or social protection. For finance, we ended up reviewing 8 documents, and those were 4 county budget implementation review reports and 4 national budget implementation review reports. That gives us 68 documents that we reviewed in total. Next. In terms of analysis, for finance, we were keen on the sector level trends, that is in terms of budget allocation and expenditure for the 3 thematic areas: early childhood education, primary health care, and social welfare. We also analyzed the trends in the trend period of 2020 to 2024 for budget allocation. But for expenditure, we only analyzed the trend between 2020 to 2023. Reason being, by the time we were collecting this data, the year was still in the middle, so we thought 2024 will not give us a clear picture. In terms of analysis again, we have focused allocation at the ministry level, an average for all the 47 counties, and also for the 7 sampled counties. And budget allocation trends. In budget allocation trends, we were looking at the numerator being the allocated budget and the denominator being the total budget at the national ministry or department concerned. And then in terms of expenditure, the numerator was the actual expenditure and the denominator was the allocated budget expressed as a percentage. On policy, we adopted the coding developed by a POA study of 2022, computing proportions of national policies and the county CIDPs disaggregated by nurturing care components. And in this, we were looking at the proportion of policies that were mentioning nurturing care subcomponents, but also had a plan of implementation. We were also looking at the proportion of policies mentioning nurturing care subcomponents with no plans of implementation, and finally those that did not mention nurturing care subcomponents at all. Next. For qualitative data, as I mentioned, we collected data in 7 counties, the ones highlighted green, which were representing the different economic blocks. We had Trans Nzoia County, Siaya, Nairobi, Kajiado, Garissa, Tharaka Nithi, and Mombasa. Next. In terms of the interviews and focus group discussions, in total, we conducted 123 interviews, including 14 focus group discussions, as you can see on that table, and drawn from different departments or ministries or government agencies, as well as civil society organizations. Next. In terms of processing and analyzing qualitative data, transcription happened immediately after data collection. Qualitative data analysis was conducted using NVivo version 12, applying deductive and inductive coding approaches, and the data was systematically coded, cleaned, and prepared for report writing with regular reviews sessions ensuring accuracy, consistency, and thematic coherency. So in a nutshell, those are the processes or protocols we followed in collecting data. I want now to hand over back to the moderator for the next session. Thank you.
Thank you, Professor Muma, who also notably is the Kenya Country Coordinator for the European Early Childhood Education Research Association. We usher in Dr. Caroline Mwangi, who's a child health expert with a background in medicine, surgery, and medicine in pediatrics and child health, both from the University of Nairobi. She's also an ECD champion and a fellow in the Global Health Afya Bora Consortium, playing an important role in the development of newborn child health and early child development policies, strategies, and guidelines to aid in reduction of morbidity and mortality in newborns and children. She is a mentor and trains other healthcare workers on high-impact interventions, her interests being strengthening health systems and in implementation research in science to improve newborn and child survival. Karibu, Dr. Mwangi.
Thank you, Sally. Thank you, Prof. Moma, for laying the foundation for the dissemination of the policy results. Yes, if we can move to. So as outlined, I will be going through the policy section, and we referenced the sub-components that we used for this desk review using the ABOA study as a reference point. So good health, which is a component of nurturing care, we had 13 sub-components. Adequate nutrition had 9 sub-components. Responsive caregiving, 9 subcomponents as listed. Safety and security had 10 subcomponents, and opportunities for early learning had 7 subcomponents. So this was what we were reviewing in the policies to find out whether there was a mention of these subcomponents, whether there was a mention with a plan and a budget, and if there was no mention. Next slide. So the 9 policy documents that we included for review, as earlier outlined using the criteria defined, we categorized them into 4 sectors. Education, where we had the Early Education Act 2021. For health, we had the Kenya Community Health Policy and the Newborn and Child Health Strategic Plan. Social protection, we reviewed the Kenya National Care Policy of 2024 and the National Positive Parenting Program Guidelines. And what we categorized as multi-sector policies were the 4th Medium Plan, the Kenya Integrated Early Childhood Development Policy, the draft, this is the draft policy, the Children Act of 2022, and the Demographic and Health Survey Report of 2022. So if you look at the graph here, adequate nutrition was the most referenced in 8 out of the 9 reviewed documents, while good health and responsive caregiving was referenced in 7 out of the 9 documents that we reviewed. The list, the documents that referenced, the component that was referenced, the list was opportunities for early learning, where only 3 policies made reference to it. Next slide, please. Now, when we look at the county level sectoral policies, as earlier outlined, we reviewed the county integrated development plans. And when we looked at the reference to the nurturing care components, the 5 of them, we found that good health was referenced in all the county, the CIDPs. Adequate nutrition was included in 96%, and early learning was included in 98%. However, responsive caregiving, only 26%, and this means that only 12 out of the 47 CIDPs we reviewed referenced responsive caregiving, and only 30%, or 14 out of the 47 CIDPs that we reviewed referenced safety and security. Next slide, please. Now, the specific subcomponents that I'd earlier mentioned, that for good health were 13, we find that for some of them, I'll not go through all of them, but just highlight a few. We see that nearly all the counties had a budget and a plan for family planning and immunization. However, the subcomponents that had the least reference or did not have a mention of budgets or plans for kangaroo care, preterm birth prevention, and care for sick newborns. And also early detection of disabilities was only mentioned in 32 to 40% of the CIDPs. Next. So when we look at adequate nutrition, where we see we're reviewing the CIDPs that had mentioned the subcomponents with a plan or budget, or just a mention alone, or no mention. We saw that over half included plans for malnutrition management, micronutrient supplementation, and deworming. Child feeding during illness and food fortification only appeared in 15 to 17% of the CIDPs, and the support for maternal nutrition and complementary feeding we saw was present or referenced in slightly over half, but many still lack clear budgets or implementation strategies for these subcomponents. Next slide. Responsive caregiving. We found that only 38% of the CIDPs having a mention or a plan for childcare facilities, and 30% mentioning interventions that encourage play and communication. So involving fathers and extended families, which is a subcomponent of responsive caregiving, was just referenced by one county. And we've heard that childcare is a devolved function, and we thought this was a critical gap. Next slide. When it comes to early learning opportunities, when we reviewed the subcomponents that were included in this, the early childhood education is covered by 98% of CIDPs, and 64% of them actually had reference to good quality daycare, having a mention with a plan or a budget. However, we found significant gaps in the subcomponents of book sharing, storytelling, mobile toy libraries, play groups, and what we said for caregivers and for children were absent in most of the plans. Like we only had 1 to 2 CIDPs making reference to it with a plan or budget. Next slide. So the last subcomponent on safety and security, which is an important component of nurturing care. Over half of the counties have a plan to ensure safe water sanitation, hygiene, that's WASH, and to prevent intimate partner violence. And birth registration was mentioned by just 3 counties having a plan or a budget, and 19% mentioning them. Supporting family or foster care over institutional care is largely absent. We had 89% of the CIDPs having no mention of this subcomponent. Next slide. So we came up with this summary of the subcomponents that I've just taken you through the components and the subcomponents. This is a graphical representation of the degree to which the counties either had a mention with a plan and budget, or just a mention alone, or no mention of the subcomponents. So if we look at the first map on the right, the green, where we see the darker shade of the green represents the degree to which that county had a plan or had a plan and a budget for that subcomponent. And the lightest shade represents 1 to 3 subcomponents mentioned. The darker shade represents 10 to 12. And we look at the blue map also for responsive caregiving, and the gray map for safety and security, and the early learning having the orange shades and the brown shades for adequate nutrition. So we can appreciate visually how some of the components of like good health has quite a number of components having the darker shade, adequate nutrition the same. Then we start seeing the gaps that we had outlined for responsive caregiving and safety and security, and also for early learning. Next slide. So in conclusion, we saw that good health and adequate nutrition are well covered in the national sector and the county sectors, although we had some subcomponents of these two components having some no mentions or plans, which we thought should be prioritized. Then responsive caregiving, as we've said, it was poorly integrated, especially in education and other sectors, and minimally represented in the CIDPs. For early learning, we saw that it was underrepresented in health and social protection, but it is featured in education. And in the county, ECDE is prominent, but we saw the gaps in subcomponents such as book sharing and storytelling. And also we've seen that safety and security received less mentions in the multi-sectoral and health policy. And in the county, the coverage varies. So we do appreciate that a lot of these national policies are sector focused, but next slide. Hence, that's why we are making the recommendation that we do integrate some of these policy frameworks to ensure that the nurturing care components are covered in all the sectors. Then we also recommend the same for our holistic county CIDPs to include all the components to strengthen our health and nutrition interventions, also investing in responsive caregiving. We've seen mental health support and promoting caregiver sensitivity, including extended family involvement or a father or male figure. And want to emphasize the inclusion of safety and security into the national and county policies in collaboration with the national government. And to achieve all this, we need to do a lot of advocacy and capacity building to our policymakers and implementers on holistic child development. So thank you, and I hand back over to the Secretariat to introduce the next speaker.
Thank you so much, Dr. Caroline. Our next speaker is a qualitative research expert and with over a decade of experience in research, specializing in program evaluations, impact assessments, and system measurement. He has worked with leading organizations such as the World Concern, APHR, AFIDEP, contributing to research that informs policy and program development. Eric is passionate about using technology-driven research solutions, including NVivo, to enhance data quality and efficiency, currently actively involved in the phase 2 project of the ECD systems measurement. Karibu sana, Mr. Eric Waga.
So I will take you briefly through the qualitative findings. And to start us off, I'll talk about the level of functioning county government-led multi-sectoral coordination mechanisms. And we see that at the national level, the National Council for Children's Services and the Ministry of Education guide coordination, while at the county level, coordination shifts between the health and education sectors, while with some counties, the coordination being led by a steering committee or established governance office. Some of the key barriers identified included financial constraints, donor fatigue and policy delays, lack of a unified, well-funded national coordinating body with clear mandates, limited stakeholder engagement and unclear national county government roles, and lack of clear coordination framework in some counties. Next slide, please. So collaboration among the ECD actors. The key government collaboration for ECD involves multi-sectoral partnership between ministries such as health, education, social protection. And this collaboration extends to NGOs, civil society organizations, and international agencies to improve service delivery, especially in marginalized areas. In terms of meetings, these are largely held quarterly or as needed for updates, collaboration, and issues resolutions. And they are multi-sectorial in nature, including departments like health, education, agriculture, etc. In terms of funding, they heavily rely on external donor funding due to inconsistent government support. And at the national level, funding is supported by the government, but still supplemented by development partners. Next slide, please. Communication largely occurs through emails, meetings, WhatsApp group, or virtual platforms, while some organizations engage in structured, frequent discussions, while others rely on need-based communications. And decisions are influenced by government policies and multi-sectoral engagements. Some counties use consultative approaches, while others have centralized decision-making structures. Some of the challenges include inconsistent funding, bureaucratic delays, and competition for visibility, inadequate resources, poor coordination, and high turnover of officials, communication breakdowns and duplication of work, donor criteria mismatches, and misaligned expectations of priorities. Next slide, please. I'll briefly talk about data and data utilization for ECD policy and decision making. So data is largely available through the DHIS, KHIS, CPIMS, NEMIS, and in some counties like Nairobi, Mombasa, and Garissa, the data is well organized, while in other counties, the data is inconsistent. The data is largely used to guide resource allocations and interventions. For example, in health and nutrition, the data is used to guide programs on immunization, school feeding. And in education, teacher distribution, and infrastructure planning. Some of the challenges highlighted include fragmented data systems and outdated information, lack of integration across sectors and reporting delays, limited accessibility and technological constraints, and solution suggested is having a centralized data system for ECD data, having digital tools and validation process. Looking at the political, social, and economical factors, how they affect issues to do with data, politically varying priorities, favoritism, instability affect resource allocation. Socially, cultural resistance, geographical disparities impact data accuracy and acceptance. And economically, funding limitations and competing priorities, especially in marginalized areas, is a big challenge. Next slide, please. So as highlighted earlier, we also talked to the community health assistants, the CHAS, and the community health promoters, the CHPs. And their main role at the community level includes promotion of proper feeding and immunization, encouraging school attendance and child protection, engaging caregivers and fostering community collaboration. Their source of knowledge mainly through personal experiences and family traditions, and formal education and community trainings by various organizations such as AMREF, AMPATH, PATH, and others. So some of the resources that they have include the MWAC bands, weighing scale, thermometers, and education materials. Next slide, please. So how they implement nurturing care at the community level. Roles and responsibilities at household and family level include providing health education, referrals and support for child nutrition, among other services. They also conduct regular community visits and caregiver training. They address broader social issues such as gender-based violence and mental health, and engaging parents, including fathers, to ensure sustainable health practices. At the health facility level, the CHARs act as a bridge between health facilities and communities, while the CHPs promote health awareness, referrals, and default tracing. Collectively, they ensure continuity of care through education, outreach, and follow-ups. Some of the success stories include improved vaccination and timely immunization, increased community awareness on child protection and family planning, strengthened healthcare access, malnutrition management and prevention of mother-to-child HIV transmission, community programs. Some of the community programs include the dialogue days and health action days that boost awareness and engagement, amongst other success stories. So challenges highlighted include cultural beliefs, financial constraints, logistical issues, and community resistance. Also challenge to do with resource shortage and lack of recognition. Next slide, please. So some of the recommendations are: one, strengthen multi-sectoral coordination by establishing a well-funded national and county level framework for collaboration and policy implementation. Improve stakeholder collaboration by developing a clear framework for joint decision-making, data sharing, and cross-sectoral engagement. Increase funding and resource allocation by advocating for sustainable ECD funding, diversifying sources, and reduce donor dependency. Develop a robust ECD data system, centralized data, enable real-time tracking, and enhance accessibility for informed decision-making. And lastly, provide training, financial support, and logistical empowerment to the CHARs and CHPs. Thank you, and back to you, moderator.
Thank you so much, Mr. Eric. We have Dr. Moses Oyagi, monitoring and evaluation expert, who is a seasoned expert in research, monitoring, evaluation, and learning with a strong focus on policy analysis. His extensive career includes significant contributions to the development and implementation of policies that enhance program effectiveness and impact. His work often involves conducting research through evaluations and providing data-driven insights to inform policy decisions, ensuring that programs are both effective and sustainable. Karibu, Dr. Oyagi.
Thank you very much, Sally. Thank you, Aga, and good afternoon, everyone. I'm excited to walk you through our findings on finance indicators. So this slide focuses on budget allocation and expenditure trends, and this is for early childhood education at national level. The first chart illustrates the percentages of the total education budget that was allocated to ECE over the 4 financial years. So as you can see, initially, there was no budget allocated for ECE in the first 2 financial years, 2020, 2021, 2021, 2022. However, starting from the financial year 2023, 2022, 2023, 1% of the total education budget was allocated to ECE, and this allocation remained consistent in the following year, that is 2023, 2024. Moving on to the second chart, sorry, on the same slide. So the second chart shows now the percentages of the allocated budget, how this budget was actually spent over the 3 financial years. Again, just to remind you, from the methodology, we saw that we are not including the 4th year, 2023, 2024, simply because by the time we're doing the data collection, the year was still incomplete. So we left it out in this analysis. And this is what we'll be seeing on all the expenditure charts. So looking at this chart, we can clearly, of course, we don't expect any expenditure for the first 2 years as there were no allocation. But for the third year, financial 2022-2023, the 1% which was allocated, we can clearly see that all of it was spent. Next. Now here, the focus is on, again, budget allocation and expenditure trends, but for ECE, but this time at county level. Beginning with the first slide chart, we can clearly see that there was the percentage total county budget allocation for ECE across the 47 counties. So the figure we see here is an average of the 47 counties. So you can see consistently for the 4 years, the budget allocated was 34%. And this is here consistent for the 4 years. The second chart now, now we are looking at how the consumption was for the 3 financial years. We can clearly see that there was an increment from 65 in the initial year to 72% in the second year, and this remained consistent through the third year. Next, please. Now, these two charts here, the focus is still on budget allocation and expenditure on ECE, but now we zooming into a sample of counties just to give us a picture on how the allocations looks like and expenditures within the individual counties, because the earlier we saw it was an average of the 47 counties. So the sample counties here are Mombasa, Tharaka Nithi, Trans Nzoia, Kajiado, Siaya, Nairobi, and Garissa. And we can clearly see fluctuations in terms of budget allocations. That's chart 1. And we can clearly see that Mombasa, the first year, the highest they allocated was 62% of their total budget. That was in their first year, financial year 2020-2021. And Tharaka, it's between 20% to 26%. Trans Nzoia, between 10% to 33%. Kajiado, initial year, budget allocation was high at 89%. Siaya, very minimal for the first 2 years, 1%, and then it kept on increasing to 40%. Nairobi City, the initial year, they had allocated 15%, but we saw that increase to 97%. And Garissa averaged between 13% and 6%. So clearly a fluctuation there. And on the expenditure side, we can also see that not all of it is expended for some of the counties and is not consistent in all the counties. So 34%, the cases of even no expenditure at all, like we are seeing 0 Mombasa in the second year and the Trans Nzoia in the third year, that's 2022-2023. And we can see 100% expenditure for Siaya for the first year and also Nairobi for the third year as well. So again, not consistent, it keeps on fluctuating. Next, please. So we now move on to the primary healthcare sector, again, starting from looking at how budget was allocated and expenditure trends, beginning with the national level. Clearly, you can see that the budget allocation as a percentage of the total ministry was 25 in the year 2020-2021. And so this kept on dropping, as we can see from the trend over the years. Going to the expenditure side, that's the second chart, we can clearly see that and not all of the money that is allocated is expended. And you can see it's as low as 42% and as high as 68%. And next, please. So same trend, looking at the county level for the budget allocation and expenditure. And again, this is an average of the 47 counties. So we can clearly see that Again here, very minimal budget allocations to primary healthcare, averaging from 12% in the year 2020, 2021, and fluctuating between 12% to 16% over the 4 years. On the expenditure side, a bit of stability, moderate expenditure at 73%, which almost stabilized at that for the 3 years that we analyzed. Next, please. Again, now zooming into Sambo counties just to see how budget was allocated and how the budget was expended for primary healthcare for the 7 counties I did mention. So clearly you can see, again, fluctuations when it comes to individual counties and very low budget allocations as low as 2%. You can see that for Mombasa as low as 1%, Nairobi City, that is the third year. So very minimal budget allocations, again, not stable over the 4 years. And looking at the expenditure side, interesting, we could see some counties, they even overspent the 2%, like for Mombasa that was allocated. They actually overspent it by 13%. That means they got money from other budget lines for that. And then we could also see Siaya spending all the budget that was allocated. Garissa the same. So, but again, what we get from this is that there's a lot of fluctuations again across the individual counties. Next, please. Now the next sector is social welfare programs, targeting children 0 to 5 and their families. So again, we look at budget allocation and expenditure trends at national level. Starting with the first chart, which is the budget allocation, clearly we can see some growth, very minimal budget allocation, but growing over time, ranging from 9% in the initial year 2020, 2021 to 16% in the year 2023, 2024. On the expenditure side, we can clearly see that the first year, all the 9% that was allocated was spent and over got a 1% from another budget line. But the following year, we can clearly see that not all the 12% that was budgeted for was expended. They only spent 87%. The third year, about 95% of the budget, that's what was expended for that year. So so then again, moving on to county level, the same order, we can clearly see that there's a bit of again, stability when it comes to the average for the 47 counties, but not quite. It's ranging between 20 to 25. Initially budgeting at 25%, that rising up to 27%, coming down again, and then again further down to 20%. Looking at the expenditure side, again, the expenditure here, which we could consider moderate at 64%, remaining somehow consistent across the 3-year period for the 47 counties. Next, please. Now zooming into the individual counties, the 7, we could see in terms of budget allocations, there's good sign of budgeting, 99% for some years, 0 for some years. So again, seeing fluctuations. Trans Nzoia, we can clearly see that there was no clear budget line for social welfare based on the documents we reviewed. So that was 0 budgeted for. And again, for some years for Nairobi City, Garissa, and also as Kajiado, we have zeros. When it comes to expenditures, well, we could actually see as much as we're seeing Nairobi the first year being budgeted for 99% when it comes to expenditure. Of the 99%, only the 5% we can see spent. Of Kajiado, we can see again the expenditure was dropping over time from 68 to 37, and then to notice Nairobi City, so they could only spend of 3% of the 65% for the first year. Next, please. Yeah, so based on what you've seen, it's clear that for the ECE, there was some stability in terms of budget allocations over time. So the real issue was on the side of expenditure, whereby that we saw that not all the money that was budgeted for was being absorbed. So on that line, then our recommendation is that county should be consider strengthening their financial planning and expenditure efficiency to ensure that the allocated funds are fully utilized for ECE. On the primary healthcare sector, there were a bit of fluctuations, and this was both at the national and the county level. And based on that, we recommended that both national and the county governments should be able to allocate more consistent and predictable funding to primary healthcare to ensure sustainable service delivery. For social welfare, what was coming out is that a lot we saw in terms of budget allocation, a good proportion of the budget allocated, but on the side of expenditure, very minimal, pointing to a possibility of diverting funds to other budget lines. So based on that, we make a recommendation that counties should be able to earmark specific portions of their budgets, which are exclusive for social welfare programs, so that they're able to prevent these funds from being diverted to other budget lines or areas. And next, please. Yeah, thank you very much. I now hand over to moderator. Thank you.
Thank you very much for that presentation. We have heard during this session from Professor Muma, early childhood specialist, also national coordinator for ECD Kenya. We have heard from Dr. Caroline Mwangi, child health expert. We have heard from Eric Waga, qualitative research expert, and from Moses Oyagi, monitoring and evaluation expert. They have spoken about the study they did, ECD Measurements Study, focusing on financing, policy integration, and multi-sectoral coordination. We had encouraged you to be writing questions at the question and answer tab. Some of you have written questions. This is the time when we embark on answering them. So we will endeavor to answer as many as we can. And the ones which we're not able to fit in the short time we have, we will endeavor to make sure that you get your answers. But now we want to go into the question and answer session. My co-moderator, are you ready?
Yes, I am.
Thank you.
The first two questions goes to Professor Moma. David asks, based on your presentation, many counties are having insufficient ECD centers and lacking proper classrooms, play areas, sanitation facilities. Where in your study did you get the missing link based on the children development that must be enhanced at the age of 1 to 5 years? Again, where in your study did you get the missing link based on the children development that must be enhanced at the age of 1 to 5 years? And a second one for you as well, the criteria used to include the 7 counties in the study and what data analysis technique was used to analyze the quantitative data. To you, Professor Moma.
Sorry, I was speaking while mute. Thank you so much, David, for the question. Before I answer the question, I would want to reiterate that this study was measuring the systems level, meaning we were looking to see what policies are available, what are they saying in terms of nurturing care. We were looking at the systems level in terms of how financing should happen. And therefore, we were not going to the nitty-gritties of the what happens maybe in the classroom, because if finance is allocated towards ECD programs, then we will have the various activities related to early childhood education to be supported. So I thought it is important at this point to say this, because I've also seen several questions that requires are asking about the specifics, but it's important to let you know that we were looking at the systems level. So to come to your question, in terms of maybe having what is required at the ECD centers in the classrooms, or even at the teaching learning materials, then it points back to financing. And as you saw from the findings on finance, financing is done minimally, but again, even what is financed is not all utilized. So that can explain why certain things in terms of infrastructure, in terms of teaching, learning, materials, and even the teachers would not be able to be met. The second question you asked is about how did we select the 7 counties. As I mentioned in my presentation, we selected 7 counties from the economic blocks, and we did this systematically, where the counties for the particular economic block were listed, and then systematically we were able to randomly select one to represent that economic block. Apart from Tharaka-Nithi, which represented 2, that is the Lower Eastern and the Mount Kenya region. So that is how we selected the 7 economic counties to represent the economic block. Was there another question, Sally?
Those 2 for now. Thank you, Professor Moma.
Thank you.
We would like to embark to Dr. Caroline. The first question is, what policies and mechanisms should be put in place to prevent child abuse, neglect, and violence in ECD settings? What policies and mechanisms should be put in place to prevent child abuse, neglect, and violence in ECD settings? And with gathering from the results here, especially for the nurturing care elements, were from a planning perspective. Mr. Evans asks, were there any attempts to establish that the planned activities were actually executed or are being executed? Were there any attempts to establish that the planned activities were actually executed or being executed?
Okay, thank you for your question. I'll start with the last one. I think Prof. Moma has already established that we did a systems level analysis, so we did not establish whether these plans were being executed. We're just looking at whether the plans and the budgets are available and what is allocated. That can be a future research topic for us. Then when it comes to how do we ensure that child abuse, neglect, and violence are prevented in ECD settings, that's by counties ensuring that there's legislation. We know that childcare is a devolved function, so ensuring that there is legislation, and more importantly, that even when this legislation is passed, there's enforcement. So just coming up with the quality guidelines on quality of ECD centers, ensuring that they're regularly monitored, ensuring that the people taking care of these children are capacity built, and involving also parents, and advocacy and awareness will go a long way in preventing these vices against our children under 5. Thank you.
Thank you so much. To Mr. Waga, how can counties strengthen multi-sectoral collaboration, that is health agriculture education, to improve nutrition outcomes for young children? And what is it that you have put in place to ensure that the capacity building is done to the CHPs for effective implementation of this program? Mr. Waga?
So to strengthen multi-sectoral collaboration, and I think these are the other KPIs will chip in, is basically actively involving the counties and working collaboratively, so that and also having, if possible, having an dedicated ECD department guiding this, so that in the end all the ECD components taken care of at the county level. The second question, sorry, come again. It was about the CHPs.
Yes. What is it? I think Mr. Okewa wants to understand what is it that you have put in place to ensure the capacity building is done to the CHPs for effective implementation of this program?
Okay, so for clarity, nothing has been put in place by the organization, but a suggestion will be more of sensitizations at the community level. Thank you.
Thank you so much. Dr.
Maybe
Oyagi,
I can, okay, sorry.
Karibu, Professor Moma, kindly chime in.
I just wanted to add on what Erica said. In terms of strengthening multi-sectoral coordination and collaboration, there is need to have a framework that outlines the different roles and responsibilities of various players and actors in the ECD space in terms of funding, in terms of decision making, in terms of data sharing and the like. Once we have that framework, then it will be easier to have multi-sectoral coordination. Thank you.
Thank you so much. Dr. Moses, are there ring-fenced resources to support ECD in the counties? There is evidence on counties engaging on functions that are not devolved, like giving bursaries. Will this be resources that should be going multi-sectorial programming at the county level? And your second question, are there innovative financing models that counties can adopt to improve ECD funding?
Thank you very much, Sally, for the two questions. Maybe to start with the first question, you indicated that there are clear signs of maybe just try to whether I understood the question. Is about ring fencing, right?
Yes. There are ring-fenced resources to support ECD in the counties, and there's evidence on counties engaging on functions that are not devolved, like giving bursaries. Could this be resources that should be going multi-sectorial programming at the county level?
Yeah, so I may not be able to say yes or no, but based on what we've seen from the analysis, clearly, and especially for the social welfare, we saw what was budgeted is not, I mean, a good proportion of budget was allocated, but again, when it gets to expenditure, minimal portion in that budget line. And probably could be the reason that that could explain or support that some of these resources are the ones getting out to other budget, so to say, budget lines or other what the counties can look at to be politically relevant to them. So yeah, based on the data we are seeing, yes, that is possible.
Maybe to add on what Moses has said in terms of ring fencing, when he was presenting and we saw in terms of allocation, and if we can use the example for the 7 counties that we went, you saw like, for example, one county allocating 2%. But when it comes to expenditure, the county is spending 113%. Then the question is, where did they get this and what made them to spend that? But even when you look across the different counties, you realize allocation was not very high. But even expenditure, some counties are not able to expend what was allocated, which was not enough. So that tells you, because the question is, where does these resources go? Maybe the remaining resources maybe are allocated to other departments or other functions or other budget lines within the county. So ring fencing is very critical to ensure that funds that have been allocated either to early childhood education or primary health care or social welfare programs are used for the activities that they have been allocated for. But again, even beyond that, one of the other challenges that we realized, delay in disbursement of these funds sometimes also makes it difficult for a particular department to utilize all of the resources. So early disbursement, ensuring that the funds that have been allocated for various departments or of budget lines are utilized. We'll all work towards ensuring that ring fencing is done and absorption is also utilized for the correct activities. Thank you, and over to you.
Yeah, so
Thank you
thank you.
so much. Yes,
Oh
Karibu.
yeah, there was a second question, right?
Yes, there was.
I think that partly answers the second question. Maybe what I can add also, there's need to have clear budget lines. And this is what we are seeing, that especially for social welfare, there were no clear budget line for social welfare programs. It's in some cases for some counties for ECE. So one way to make sure that before we even ring fence, we need to have clear budget line for ECE, for primary health care, and as well as for social welfare. And then once we have the clear budget lines, and then what's necessary is to make sure that the money, the budget is actually used as budgeted for. Thank you.
Thank you, Dr. Yagi. While we're still on the issue of budget allocations, Prof, how effectively are ECD budget allocations translated into tangible improvements in infrastructure, learning resources, and teacher training? And what mechanisms are in place to track and evaluate these expenditures at both the national and county levels? And also, is there a minimum threshold allocation that goes to ECD?
Okay, thank you, thank you, Sally, for the pregnant question. It is so, it is so huge, but again, it points again to the specifics. I think that will require a specific study to go and explore specifically how money has been spent, which was allocated. And again, it takes me back to the fact that we were looking at the systems level, because if at the systems level, the right measures are put in place, then we will not have challenges. But it can, that will require a study on its own to study the specifics on how implementation is happening. Over to you.
Thank you, Prof. Just to bring in Dr. Caroline, given its policy and operationalization question, in the long term, and to attain financial sustainability, should the function of financing ECD be fully devolved, or a composite funding approach is more ideal?
Thank you for that question. I think this is why we highlight our findings. This is to lay the ground for such discussions between the national level and the county level, because at the end of the day, what we want to ensure is a streamlined budgeting and funding process for these activities. Allow me to also just give input on an earlier question for the CHPs. We know that there are efforts by the Ministry of Health to ensure that they are trained, and there are efforts to have inclusion of child development training for community health promoters, so that they're able to support these interventions at facility level and also at the household level. And one of the policies that we reviewed is the National Positive Parenting Program. I've seen some questions on the kind of support that can be given to caregivers, especially mental health support and training for child development. So we know that the responsible state department is disseminating this program and is in the process of having also equivalents of our community health promoters at the community level. There are equivalents to ensure that there is capacity building of both caregivers and these promoters at community level to educate parents on techniques of responsive caregiving. And I know this program also has an aspect of mental health for the caregiver to ensure that they are taking care of their mental health to have optimal responsive caregiving. Thank you.
Thank you, Dr. Caroline. Mr. Waga, in your view, did the study unearth what is happening with children aged 1 to 3 who are not in ECE, neither are they seen in the health facilities? How is the system responding to their needs in relation to nurturing care?
No, it was not specific to that category of children because it was general about children.
Okay, thank you.
I think to respond to that, when we are looking at the primary health care, as we mentioned, we are looking at the preventive and the promotive programs that are supporting that where young children are also benefiting from. And also when we are looking at the social welfare programs, we are also having those children in. In other words, what we are saying is the fact that they don't have to be in school for them to be able to benefit. But are there programs that have been put in place? Of course, yes. When we think about promotive and preventive, things like immunization comes in and all the others for their moms and everybody. And therefore, in that way, they are taken care of.
Thank you, Prof. Now that you mentioned a little bit about programs, how can counties create programs that empower caregivers, those are mothers, fathers, and guardians, to actively engage in early childhood development? Your thoughts?
And that now takes us to advocacy, which was one of the recommendations that was given, I think, from Eric's presentation. So advocacy and capacity building to sensitize the caregivers, the parents, and the community at large on the importance of stimulating their children or getting involved in various activities will happen. So at the system level, it is about capacity and advocacy on the same.
Thank you, Professor Moma. Just to go back to Dr. Caroline, and somebody would like to know, how can counties ensure inclusivity in early learning for children with disabilities and those from marginalized backgrounds?
Okay, thank you. I've also seen a related question on issues of children with disabilities. One of the subcomponents of good health that we analyzed was early detection of disabling conditions and care for children with developmental disabilities. So the Ministry of Health has put in place guidelines that children should undergo growth and development screening every month for the first year of life, and thereafter every 3 months until they are 5 years old. So the first thing that we should ensure is that children, when they come to our health facilities, because between 0 to 3, before they get into school, they're in contact with the healthcare system, that they are screened. So just ensuring that parents are bringing their children for developmental and growth screening so that we can detect these conditions early. If a child has a learning disability or a physical disability, a learning disability will obviously be picked up later while they're in school. So having in place measures and ensuring that this screening is being done. More important, once a child is suspected of having a developmental delay or any condition, ensuring that they are linked to care that will be able to support either a further analysis to come up with a diagnosis, and also a rehabilitation process once a diagnosis is made. And then also for counties to come up with frameworks that ensure that the centers that these children are linked to for special needs education are properly funded, the caregivers are sensitized on care, and more importantly, that the teachers who are taking care of these children in these institutions are capacity built to deliver interventions that will benefit this child. So we know rehabilitation can be lifelong for these children. Some of them may require devices, and of course, ensuring that these items are subsidized or support is given to the caregivers to ensure that this child is receiving holistic support to ensure that based on their level that they can optimally develop even with the learning disability, at least to ensure that their quality of life is improved. Yes. Over.
Thank you so much, Dr. Caroline. Let's jump back to financing, and this is to you, Dr. Oyagi. On the financing aspect for ECD under the three thematic areas, that is early, primary, and social welfare. In the case of the sampled counties, did they have a homogeneous model for the budget allocation? What are the metrics or drivers that informed the allocation? And also, in the study, what would be the possible explanation for the variation in budget absorption by the sampled counties?
Thank you, Sally, for the question. Yes, indeed. For the 7 sampled counties, there were, in terms of budget allocation, the strength varied across the 7 counties. So they're not homogeneous, so to speak. So we had some counties who have a good allocation, others not really. But again, even the counties who have allocated, the allocation is not consistently for the 4 years. So basically what's coming out from the 7 counties is fluctuations across the years for the same county. And again, when you compare the counties, again, some are strong, some are not strong. So yes, so it's not homogeneous.
Thank you, Dr. Oyagi.
Maybe to add on what Moses has said, if you look at the allocation for the 47 counties, because what we did in order for us to see where the 7 counties were, we did an average of allocation, for example, in early childhood, and you saw it was across all the years, it was 34%. And when it came to consumption, you saw it was almost the same. That was 73, I think, if I'm not wrong. Which shows you, when you look at, on average, the 47 counties, how they are distributing, allocating, and utilizing the funds, there is some kind of homogeneity or a uniformity. But when you go now to the 7 counties, that's when you start seeing a county allocating like 2%. So 2% against maybe 34%, which is an average for all the 47 counties. That tells you that there are something needs to be done to ensure that at least every county is budgeting closer to what the average is. Over to you.
Thank you, Prof, for delving deeper into that topic for us. And allow me to come back to you still, just to understand now, in terms of teacher education, what is the role of teacher education in promoting embedding of what works in ECD and ECDE? And while you're at that, there's somebody who would like to understand what are the cultural beliefs that affect nurturing care in these counties? If you came across this, back to you, Prof.
Okay, thank you, Sally. In terms of the systems level, it's all about capacity building of the teachers, which involves training. And in terms of the systems level, is, for example, where we have the national government through the Teacher Service Commission requirement of having all teachers who have been trained, who are teaching in our pre-primary schools, should be registered by the Teacher Service Commission. That is a system that has been put in place to ensure that every teacher that is employed in the county ECD center is trained. So at the systems level, that is what I can speak. But going to the specifics on the importance, everyone knows that having teachers who are capacity building, who are well knowledgeable on the pedagogy, definitely, they will yield good results. And again, ideally, if the requirements are that all teachers who should be in our schools are trained, then we don't expect to have untrained teachers teaching our children, but the situation might be different. But at the systems level and the systems that have been put in place, the requirements are that we should be doing the right thing. But is that what is happening? We can do another research maybe, or another team can do another study to tell us what is happening on the ground. Thank you.
Thank you, Prof, for those remarks. And while we're talking about what's happening in this study, Dr. Caroline, what strategies can be used to enhance mental health support for young children and their caregivers? a question on mental health.
Okay.
What strategies can be used to enhance mental health support for young children and their caregivers?
Right. The Ministry of Health has various guidelines in place to ensure that there's screening. The first instance is screening for any mental health conditions when people present at facilities and even children. Though mental health conditions are not as common in the younger children, they'll start manifesting in the older children. But for caregivers, as we've said, the package for early childhood development mentions that caregivers should be given support and equipped to actually just at household level simple questions that they can be asked by either a community health practitioner about their mental health status and referral given to the health care facilities if the need arises. But also, as we said, the parenting program, dissemination and training and capacity building will ensure that caregivers and parents are equipped with the skills to ensure that they are taking care of their mental health and also that of their children. So I think it just all lies with advocacy, sensitization, and ensuring that we are taking care of our mental health as caregivers and giving the best to our children. Over.
Thank you, Dr. Caroline, and thank you, everyone. I now pass the baton back to Mr. Munaweza. We're done with the question and answer session. Back to you, Mr. Munaweza. Asante.
Thank you very much, everyone. Thank you for that session, which was addressed a number of questions. I can see that you still have other questions. And we also know that when you are registering, you sent in your questions. We may not have responded to them in this webinar, but we will endeavor to get back to you with the responses to those questions in the course of time. We have your email addresses and we will respond to them. I think one of the things that is outstanding is a question that is not a question technical. It's not about the presentation per se, the technical bit of the presentation, but several people asking whether the slides will be shared and what the contacts of the presenters are. I just want to give Professor 1 minute to respond to that. Will you share the slides? And secondly, is there a way in which the contacts of the presenters can be shared so that there can be further engagement? Professor?
Okay, thank you so much, colleagues. Once we are through with the dissemination of the findings, we should be able to share the slides, but not immediately now, because this is the very first beginning. Because we have your contacts, we should be able to share at the right time. And in terms of our contacts, the Secretariat should be able to share at our contacts through emails so that they can have our emails if they want to reach out to us. And I want to believe that all those who attended our series of webinars last year, you got your certificates of participation, because that's also one of the things that we are doing, because we know this is a knowledge sharing and we should be able to have something that shows that you participated. So if you participated in all the 4 last year, you should have gotten a certificate indicating all that you joined. This year, we will do the same. Thank you, and sorry for going overboard, Munaweza, but I thought it is helpful to share this to all our people.
Thank you
And
very
if
much.
anybody did not get their certificate, they can write to the Secretariat and Secretariat will be able to send it.
And on the screen, we have the email number and email address and the WhatsApp number to get in touch with the Secretariat so that they can be able to send you your certificate. And if by the end of the year, as we progress this year, you don't get your certificate also for this year, please don't hesitate to get in touch with the Secretariat to find out what is going on. We have got a lot this year. Like I said, this is a series of webinars we are carrying out this year, and we look forward to you attending the next one. Be on the lookout. As I say, watch this space. There's more coming. And in addition to that, we expect, we have got already scheduled a conference, 6th National Stakeholders Conference, that is being held in Garissa, 15th to 17th of July. The date is set, the venue is known, the theme is known. The theme is to promoting transformative systemic change in a child's ecosystem. It rhymes very well with what we have been looking at this in this webinar on systems. The theme is promoting transformative systemic change in a child's ecosystem. And we are calling out for abstracts so that you can contribute to the debate in that conference. The deadline for submitting your abstracts is 30th of April, 2025. Be on the lookout, register and send in your abstracts, and have the opportunity to share with other practitioners, academics, private sector, donors, civil society, research organizations, government, policymakers. Have an opportunity to engage with them during that conference. And also, we would like you to be in the conference yourself. Besides your papers, we would like to see you there too. We have got an option of being a member, participating online. We also have an option of you coming in person. You are invited to the venue in person in Garissa, but you need to register. There's an early bird option that is there. It's ending the end of March, so you are just in time. Please make sure that you register for attending the conference in Garissa, which will be held 15th to 17th of July. If you also are working in an organization, let the others know so that they can also benefit from this opportunity to present their abstracts, submit their abstracts, and also to register for the conference. We are very glad that you're able to make it to this study today. We were looking at ECD Measurements Study done by Professor Moma, ECD Childhood Specialist, who also is our National Coordinator ECD Network, Kenya. We also heard from Dr. Caroline Mwangi, Child Health Expert, from Mr. Eric Waga, Qualitative Research Expert, and from Dr. Moses Oyagi, Monitoring and Evaluation Expert on the ECD Measurement Study, focusing on finance, policy integration, and multi-sectoral coordination. We are very grateful you're able to share your afternoon with us. We thank you. We look forward to you being in our next webinar and attending a conference, sending in your papers. Have a good afternoon. God bless you.
Thank you and bye.
Thank you.
Bye.